Hi Grandma, today we're going to talk about platelets. Platelets, as you can see here, they are small irregular disc-shaped fragments about 20% the size of RBC. They are derived from these large cells called the megakaryocytes. These cells are formed in our bone marrow. Normally, each cc of our blood contain 150,000 to 400,000 of these platelets. Platelets don't have a nucleus, but they have numerous mitochondria, and they also have a glycogen storage and cytoskeleton elements. They also carry two types of granules, alpha and dense granules, which are important for the functioning of platelets. These platelets has two functions. They prevent the bleeding. They prevent the bleeding, whether it's internal or external bleeding, through a process called hemostasis. They also play a role in inflammatory reactions in our body. Activations of the platelets happen through different factors, which may include thromboxane A2, thrombin, adenosine diphosphate, and serotonin, and also some kind of cytokines like interleukin 2 and interferon gamma, and also our bad cholesterol, the low density lipoprotein. Upon activation, these platelet will undergo changes in its shape, and also there will be a release of the content of the granules, the dense then the alpha granules. This activation will also lead to the release of bradykinin in a long, complex process that I'm very sure you're not willing to hear. Let's talk about bradykinin. Bradykinin is basically a 9 amino acid peptide. This is the active form of the high molecular weight kininogen that is formed in our liver. Excuse me. Bradykinin will attach to specialized receptors on the endothelial cells, and these endothelial cells will undergo contraction and will contract and shorten, and this will allow blood component to leak out and accumulate in the surrounding tissue, causing this swelling and redness, and which are normal signs of inflammation. Also, this bradykinin will bind to receptors on the smooth muscle cells surrounding the blood vessels, and leading to vasodilation, which will allow even more fluid to leak out and more swelling to happen. Other functions of bradykinin, which you can tell it's like it has more inflammatory role, include the release of nitric oxide, prostacyclin, and also will stimulate the sensory nerves, causing pain. Pharmaceutical companies develop a class of medicines that prevent the degradation of bradykinin, to prolong its action. This class of medicines is called ACE inhibitors, referring to angiotensin converting enzyme inhibitors, which also prevent the conversion of angiotensin 1 to angiotensin 2. And angiotensin 1 is a very potent vasodilator. That's why it has been used to treat hypertension. Examples of these medicines include lisinopril, enalapril, ramipril, or any kind of medicine, almost any kind of medicine that end with the pril suffix. About the answer for your other question about aspirin as should you use it as a blood thinner, will all depends on the risk you have to develop heart problems, or cardiac events and stroke, and these factors may include your age, whether you have diabetes, hypertension, previous cardiac vascular or heart vascular problem, and atrial fibrillation, and depends on the measurement we have about your risk. Your doctor will consider aspirin as a preventive measure for you. Lastly, I would like to talk about nitric oxide, as some articles indicate that its presence in our platelets, in addition to the endothelium. Nitric oxide is a potent vasodilator, and that's why it has been used in the sublingual tablets to treat chest pain. It also prevent the aggregation or the accumulation of platelets, and so prevent the clot formation. So it's very important to keep a good concentration of this chemical in our body. How? It is easy. Vitamin D, vegetables with dietary nitrates, and fish oil and omega-3. Um, in addition to like having normal exercise, daily exercise, and these all factors will keep a good level of nitric oxide in our body. Let me know if you have any other question. See ya.